Mute yourself. Yeah, because we're about to come on board. Mute yourself, please. Everybody should mute himself. We don't want, because we want to learn. We want to learn from our sister. We are now online, and we are at two phases of our online trajectories. One is the Zoom, another one is YouTube. And I thank everybody for this, those that listened, those that stopped, that the intellectual and intellect veracity we found ourselves. And that is why we grow as veterinarians. And we grow as veterinarians because, honestly, we need to learn, because knowledge is dynamic. It's not static. It's not fixed. And we're looking about breaking the walls among our university teaching staffs. Somebody like UNN can research with somebody in FUNAAB. Somebody in FUNAAB can research with somebody in Sokoto. We're like Dr. Makao, we has gotten a research topic with Professor Jonaido of Sokoto from UNN. She's in South Africa. I think once she finishes what she's doing, she will come back to it, and I'll follow it up. I don't believe in, we will do this, and at the end, it ends with that. No, I'll follow it to logical conclusion. That's the passion, the vision, the mission, why we are here. Today, we have Nwamaka Uzonna, married to my cousin. When she won she was the best graduating student. I gave her some money openly. I didn't know I was paying part of the bride price. Before you know it, she ended in my compound. I said, wife, whether she likes it or not, that 50,000 in those days cannot go scot-free. So he didn't, I gave her, she laughed, everybody danced, and she left. The next thing is that we should come to Arondizog for her traditional marriage as a group from Okija. Not from as a vet. I went there as a Okija citizen. So that's the dynamic. And then in Amaka, Dr. Olufunke is a vet, married to a vet. That's where she differs from you. Her husband is a professor. We said that we are love. Love is blind, but we are not love. We have eyes. I have even with my space, I have eyes. With your space, Amaka, I have eyes. We take the best in our life by looking and listening and learning what surrounds you. She's going to deal with companion animal Babesioses today. And you are an entomologist. I think from the vector side of it, you've done a lot. But when we are going to bring in our ticks, we are going to bring one of the best tick products, edible products. And then when we will bring you to discuss ticks. Yeah, so I know, because I'm a company. And for those of us in YouTube, please try to subscribe to our channel. And then this topic is being streamed at YouTube. We should go back there. For those who are looking for slides, all the slides are in the YouTube. So that, and as you are watching, be ticking our YouTube channel, subscription channel, notification channel, so it will notify you next time we're on stream, and it helps to broaden the alchemy of the algorithm, our algorithm, for further viewing and then further understanding of our mission, expansion of our mission. So Amaka, please take it off from here. She will speak 45 minutes to 1 hour. Take it off from her. Introduce her to herself, though you don't know her. You are just reading out this as a topic. So I want you, next time you don't even to read, you say, yes, I've researched with her. Honestly, that is why we are here. An entomologist has a lot to research with a clinician and to research with a bacteriologist, a virologist, a protozoologist, and babesiologist. Across the cross, yes. Knowledge cuts across. And even in taxonomy, you can see there's some phases, yes, areas of interface along taxonomy. And that's why we're here. Okay, please, write down. Thank you very much for listening.
Good morning, everyone.
Yeah.
Welcome to this edition of Speak Out. It promises to be a very interesting edition, considering the very interesting topic we are going to discuss today. Babesioses, and it's going to be presented by Dr. Olufunke Adebayo. Dr. Olufunke Adebayo is a graduate of veterinary medicine from Adebayo University, Zaria. She currently works at the Veterinary Medicine Teaching Hospital of the College of Veterinary Medicine, Federal University of Agriculture at Abeokuta. She's passionate about companion animals, focusing on internal medicine, canine babesiosis, blood transfusion, and ultrasonography. She is a fellow of the College of Veterinary Surgeons of Nigeria and has a PhD in companion animal medicine. She's married to her heartthrob, a fellow veterinarian and professor of veterinary anatomy. So join me to warmly welcome Dr. Olufunke Adebayo. Ma'am, it's a pleasure to meet you on this platform today. And we are all ears. We wait for you to unravel the hidden mysteries of babesiosis. Welcome again, ma'am.
Yeah, Dr. Olufunke, the ball is now in your court. So let's have your gist this morning.
All right. Thank you so much, everyone. I'm really glad to be here. Thank you so much, Dr. Ibe, for this opportunity. Thank you, Dr. Amaka. It's really wonderful to be here. Please permit me to just go off video and then start to share my slides. Thank you. Okay, so we have been introduced adequately to the topic, and I love this. I'm actually passionate about this particular topic because it's what I've done almost, what I do almost every day. And I just love companion animal medicine. I mean, without apology. Okay, so we are dealing with babesiosis and its emerging trends. And then, so we're going to be looking at some things today. One, we're going to remind ourselves about babesiosis just in case we have forgotten some things. And then we are going to dive into World Health Organization and look at current trends. Okay, please, my slides, are they okay? Can everyone see my slides?
Yes, we're
Yes,
seeing.
you can.
Okay, all right.
Broaden
Okay,
it a bit.
Okay. Is this okay?
Yeah. Move it a bit, increase it a bit so that it will be eligible.
Yes,
Okay.
better.
Oh, excellent. Don't worry.
Right. Okay, thank you so much, Dr. Charles Ibe. Okay, so babesiosis is also known as pyroplasmosis. It encompasses almost all the body systems or body organs, and it is caused by protozoa parasites. This is what we know. And then it's very important now that we talk about babesiosis because it has become an emerging infectious disease. Even globally, it has become so significant, even in humans. It affects humans and domesticated animals. Mode of transmission is not new to us, tick bites, but other routes have been incriminated. Vertical transmission from the mother to the puppies or to the other animals, and blood transfusion or organ transplantation. Infections can range from being subclinical to fatal, and then the severity increases when we have babesiosis compromised with other forms of tick-borne diseases. So I would like to go ahead to introduce again to say that babesiosis has become of a critical health importance because of the morbidity and mortality that it's causing, across the country and even beyond Nigeria. Is of economic importance because so many animals are being lost because of babesiosis, and then global importance because there's this issue of transboundary diseases and so on and so forth. It's becoming an emerging zoonotic importance because of the human angle that babesiosis is bringing. Looking at using dogs, as an example, we see that it's caused by B. canis and B. rossi, Babesia canis and Babesia rossi. And we see that there are different subspecies in different geographical locations. But we have certain life-threatening clinical signs. Number one, which is the major that everyone knows, is anemia. But anemia can resolve because of the invasion of these parasites, into the red blood cells. But the more critical one that we need to look at, which we have not been looking at before now, is the indirect form of anemia that occurs in these affected animals because of certain immunologic factors or so many inflammatory mediators that have been seen. Sorry, this slide is not so visible, but one thing I'll just enlarge it. One thing I want us to see is that there has been trends in babesiosis, which are reported in the United States in humans now. And it was a study was done to check the trend of babesiosis in humans between 2011 and 2019. And this report was in 2023. And if you go further to the next slide, which it's a bit small, but I've tried to bring them out here, you will see that human babesiosis is found in so many countries and in so many cases. 43 is quite a lot. And then you see them comparing it to the endemicity in dogs, in cats, in cattle, and then in horses. So this brings to bear the importance of canine babesiosis, that it's not a kind of disease that we should just push aside. Which brings me to the idea that we need a holistic approach, which to give a One Health approach to babesiosis in general, before it hits us like COVID, like bird flu, Ebola, and other diseases that we thought they were just lying latent. This was how it started. And before we know it, or before we knew it, it grew from being endemic to being an epidemic. So we do not want a situation whereby canine babesiosis or babesiosis in general will grow from being endemic to being an epidemic. And this is why we must act fast now. And I know that this is why Bluebird TV is bringing such a presentation at this time to alert us that we should not rest on our oars. So looking at this innocent life cycle of Babesia, we would think it cannot fly, but just a simple tick bite. And you wonder the cascade of events, that happens following, infection of, following a tick bite from an infected tick. So that's just giving us an idea of this life cycle, of course. And then go to the next slide. Most of us, when we see cases of dogs with or without canine babesiosis, this is a typical thing we find in our hospitals. You see a client bring a dog to your hospital and voila, look at the beehive of activity in that ear. This is just the ear. And look at the way the ticks are bunched up in that particular location. So this, I just brought this out to tell us that, look, these are the things that we see often and often in some of our clinic, veterinary clinics and hospitals. So going again to babesiosis, and looking at Babesia as a matter of fact, Babesia actually has the large form and the small forms. I'm getting somewhere with bringing this classification, and the large forms, have subspecies as Babesia canis, some call it Babesia canis, Babesia vogeli, Babesia rossi, and recently Babesia species coco. Then we have the small form. We have the small form as Babesia gibsoni, even though there are other small forms that are now being identified. We're going somewhere. Now look at the pathogenicity of these Babesia subspecies. The Babesia canis, it causes mild clinical signs and is endemic in Europe. Look at vogeli. Vogeli, is endemic worldwide, but just seldomly causes clinical signs. But the main problem we're having is Babesia rossi. Babesia rossi is so virulent and is the most virulent of them all. And it's been known that it used to be just endemic in South Africa and maybe other parts of Africa. But now, If you look at the work that was done by Sasaki et al. With the involvement of Professor Mobawale, it brought to bear the presence of this B. rossi in Nigeria. And that is a very virulent Babesia we don't want to joke with because of so many clinical signs that it causes. It causes marked hemolytic anemia and often associated with complications. Now, the Babesia species Coco is often found in immunosuppressed dogs. And then looking at the small type of Babesia, which is the Gibsoni, it causes subclinical infections and moderate pathogenicity. This sample was actually from one of the work I did, and I call them beautiful Babesia, though they're not, what they cause is not beautiful. But you see, they just look innocent in those RBCs. Look at the arrows. Those are the merozoites, the Babesia merozoite. I just wanted us to see and appreciate that. And then I went further to check the bone marrow as a result of, following the death of a particular animal. And you could see, okay, I hope you can see that. Look at the arrows now showing the presence of this Babesia species in the bone marrow. So there is nowhere they can't reach, actually. This is an advanced electron microscopy just to show the Maltese, formation of the Babesia species in the red blood cells. Okay, so clinical signs. Looking at the general, now these are general clinical signs. Incubation period of Babesioses is between 10 to 28 days. And these are the general presentation that we see. You will see that some of these clinical signs are not even specific. They look so general. I mean, if you have to see a dog that is having anorexia and lethargy, it could be as a result of 1,000,001 things, but Babesia has been incriminated. So when you see a dog with fever, you want to think of Babesia. Pallor of the mucous membrane, weakness, respiratory problems, then vomiting. Who would see a dog vomiting and the next thing you're thinking of is Babesia? This is what we want to bring to bear, that don't just look at some of these clinical signs as pathognomonic of some particular ailments. You may actually be dealing with complicated form of canine babesiosis. We'll get to that in a bit. Then you see jaundice, you see splenic enlargement, you see edema and ascites because of the complication. And then shock or death, especially if it was not adequately, taken care of. Then you see jaundice in affected dogs. You look at the yellowing of the mucous membrane. This also could be an indicator that canine babesiosis is involved, among other factors. Then that will take me to the forms of babesiosis. Generally, the classification of babesiosis follows the classification of human malaria, which is caused by falciparum, Plasmodium falciparum. And if you look at what the World Health Organization did was to classify malaria under uncomplicated and complicated malaria. And so this same classification has been used for babesiosis, saying that they are both protozoan and they cause similar, illnesses in affected patients. So the uncomplicated canine babesiosis could present with regular signs such as being hypoxic, of course, because it's pale. When there's pallor of the mucous membrane, you know that dog is anemic, and then hypoxia is imminent because of the hypovolemia. Then you see fever, lethargy, splenomegaly, and lymphadenopathy. These are just tip of the iceberg. This is just like scratching the surface when you compare it with the complicated form. Because when it comes to the complicated form, let me enlarge it a bit, you will see that you could have cases of, amongst other things, you have immune-mediated hemolytic anemia. You have signs of inflammatory reactions. There is acute kidney injury, yes, in canine babesiosis. And you have cerebral babesiosis, just like we have cerebral malaria. These are the complications that are associated with canine babesiosis. Then you have red biliary. Instead of some dogs coming with pale mucous membrane, you see that they're so congested, blood red, their mucous membrane, and you'll be wondering what is wrong. Most of these dogs have red biliary, what we call red biliary. Then you have hepatopathy. the liver is involved. Then you have pancreatitis, and this would argue the fact of having vomiting or diarrhea in canine babesiosis, because there's actually a gut form of canine babesiosis, of babesiosis. So you have vomiting, diarrhea, melena, hematemesis, even in canine babesiosis. Then you have myocardial dysfunction, and then you have hydromyolysis. And someone said, what are you talking about? You mean we can have muscle pain and tremors in canine babesiosis? Yes, sir, you can have it. And this occurs because of the increased serum myoglobin. So, and that will take me to the next slide. We're still looking at the complications now, because most of us are so acquainted with the uncomplicated canine babesiosis that we do not realize that some of these dogs that are being presented and we treat for other ailments could actually have the underlying infection as babesiosis. That may be the culprit that we are not looking at. So it will just make us to be shooting in the dark. So when we're talking about multiple organ dysfunction syndrome, which is seen in canine babesiosis or in babesiosis, we see that it occurs. So we call it MODS, multiple organ dysfunction syndrome. It occurs due to certain pro-inflammatory and inflammatory mechanisms. Majorly, what you see in dogs that come down with MODS is that they have renal failure, they have liver dysfunction, they have muscle damage, and there is also lung pathology, and there is cerebral involvement. So all these are pointers to multiple organ dysfunction syndrome. And the patients in this case come in hypotensive. There is very poor or low tissue perfusion. You find out that some dogs, when you're trying to set a line for them, set drips for them, their vein has collapsed because of, the anemia, the hypoxia, then there's hypotension. Then this hypotension in turn affects the kidney. Now, the next one is systemic inflammatory response syndrome, which is seen in complicated form of canine babesiosis. I call it SARS. So in SARS, you have a clinical expression of the acute phase reactions. Well, what does this really mean? This SARS is seen in certain septic conditions, which is associated with tachycardia, tachypnea, hypo or hypothermia, leukocytosis, or leukopenia. But this is one thing I want us to note, that sepsis that is seen in SARS, it's proven that it's because of the presence of infectious agents. So now it's not only bacteria that's infectious agents that affects blood. We have viruses, fungi, and guess what? We have these parasites in the blood. And this could lead to sepsis and then lead to the generation of systemic inflammatory response syndrome. Another thing that happens in complicated form of canine babesiosis is that we have immune-mediated hemolytic anemia. No, excuse me. What happens in this case is that this occurs due to immune response to babesiosis. Normally when the body is faced with challenges, the body will want to rise up to respond, and that is normal of the body. But in this case, when the body is trying to respond to these, infectious agents, as in the production of antibody and so on and so forth, and that we have been taught the work of the spleen, what it does is that it tries to get rid of these infected RBCs. In the process, the body gets to a point where it sees itself as the enemy. So the IMHA comes in when the red blood cells are destroyed by the body's immune system, because they have seen the particular red blood cells, infected or uninfected, as aliens, as things that they should fight. You understand? So and by the time the body starts to attack its own immune system, then what happens is that the body goes to a point of depreciation, and then IMHA is imminent. The hallmark of babesiosis is actually thrombocytopenia. And this has been said over and over, and especially a well-renowned author, which I truly respect, Lobetti. He has done a lot of work in South Africa and has come up with the fact that thrombocytopenia is actually the hallmark of infection of canine babesiosis. So we see this IMHA, eventually it leads to severe anemia and then poor oxygen delivery. So this takes me to diagnosis, because now we may, like I said, we may be dealing with an enemy who is hiding in the dark. We are not able to know because of improper diagnosis, incomplete diagnosis. So we want to see how can we come in, to diagnose properly so that we can attack this menace. Now, number one area of diagnosis I want us to look at is the hematology. Now, in hematology, what do you want to do? You want to do a full blood count. Like I said, thrombocytopenia is the hallmark of the infection. So by the time you do your full blood count, the PCV, the RBC, the thrombocyte count, and you see a thrombocytopenia, you already pen down that, okay, maybe I'm likely dealing with this particular, infection. Then you want to do a parasitology. You want to do a thin blood smear. On thin blood smear, we'll still get to that in a bit. On thin blood smear, it should give us an indication that it's Babesia species we are dealing with. And then we want to do liver and kidney function tests. Liver kidney function test will guide us to know the extent of liver or kidney damage so that you can have an idea of the prognostic factors. What do you tell the client? When you see the LFT and the KFT result, you can better advise the client on the prognosis and how to take the case further. Then look at molecular, going after, oh, sorry about that. Okay. Go back. Okay. So molecular, PCR, but I have done molecular studies and I can tell you for free that it doesn't come cheap. So we are having a big problem on our hands whereby we want to do diagnosis, but there's no funds for it. So, but honestly, over and above thin blood smear, the molecular studies goes a long way to be able to tell us indeed what we are dealing with, even up to species level, to tell us the kind or the type of Babesia we're dealing with. So we want to do molecular studies. And then, thank God, kits are now available. I have some kits with me. So there are kits that are available. If you say, oh, I can't do molecular, it's too expensive. These kits, well, may not be as expensive as the molecular, but at least it's also expensive depending on the kind of practice you have and the willingness of the clients to pay for your services. So when we have kits, they're able to show us, is it Ehrlichia? Is it Anaplasma? Is it Babesia? Then I love to do abdominal scan. Why I do abdominal scan for some of these patients, not all, is because we want to see some patient may not, or some clients may not have the money for all this for kidney function, liver function. So where we begin is that, okay, let's even do an abdominal scan. If you do a scan, we can look at the integrity of the kidney, look at the echogenicity of these organs, look at the echogenicity of the liver, the kidney, and other findings that we may get. So if we can get access to ultrasonography, it will be splendid to be able to help us with diagnosis. It will not diagnose to say that this is Babesia, no, but it will tell us, the impact on the organs that are involved. Now, what do you call Babesioses? I had to bring this expression, of these dogs and cats, because sometimes what you call Babesioses may not be Babesioses. And sometimes what you think is not Babesioses is actually Babesioses. So what do you call Babesioses? Now, this next slide is interesting. I tagged it real-time diagnosis. And I wrote here that not all negatives are true negatives for Babesia species. And why I said this is because I did a work, and in that particular work, this particular sample, or some samples, were negative on thin blood smear. But guess what? By the time I did the molecular analysis or molecular studies on them, it came out positive for Babesia. So diagnostic tools, one of the major problems we have, especially in this part of the world, do we have access to labs? Do we have access to even microscopes? What about personnel and idiosyncrasies? If you give a particular sample to two people, the same sample to two people, one person may say, oh, it's positive for Babesia, Another one will say, no, it's negative. So we have that personnel issues. Then idiosyncrasy. You may think, oh, what I saw is Babesia. Another person will say, no, I just saw a dot. It can't be Babesia. So many other things, so many factors. Now look at what about expertise and specialization? Do we have people that are actually experts? Yes, indeed. In our various colleges, we have experts in parasitology and some of these other fields. But we need beyond the little microscope we have that sometimes it could go blurry. You may not even be able to appreciate what you're dealing with. Now people go for electron microscopy. But how many of our veterinary hospitals, how many of our veterinary colleges can have access to to electron microscopes? Then funding. We talked about doing molecular studies. Who is going to fund it? If the client that just brought 5,000 naira to your clinic, you want to do lab, you want to treat, with 5,000 naira, it will get us nowhere. So who is going to help us to fund our labs or to fund our clinics? In the work I did, I discovered that we are now dealing with a new strain of Babesia. So now we are going beyond Babesia canis, Vogelii, Rossi, which is the most virulent. We are now looking at new strains. That is calling for trouble. That is calling for more research. Now, in my work, I discovered that there is a new species of Babesia in town, just like a new sheriff comes to town. So there's this new Babesia. And guess what? The clinical signs were atypical. They were not typical of the normal that you nod your head to say, this is it. Number one, it was negative on blood smear. Number two, it was positive on molecular diagnosis, on PCR. Then it was found in a puppy. The puppy was about 3 months plus. And the puppy came in diarrheic. There was diarrhea. And of course, it was dehydrated because of the diarrhea. And the temperature was 39.4. I mean, if you see 39.4 on a normal day, you want to say, okay, well, it's neither here nor there. I mean, if you're having 40, you know that this is fever. That 9.4 is fever too, but you may not want to really get worried. But this dog had that 9.4. There was pallor of the mucous membrane, but thankfully it survived on oxytetracycline and IV fluids. And note there that it was negative for distemper, it was negative for parvoviral enteritis. So we have a new strain in town, which means that all hands need to be on deck. Now, with these new strains, I began to ask questions. Is there any host specificity? Because we see Theileria, we see Babesia in dogs. Takit et al. Did a work. And in this same Abeokuta, where I am, we found Theileria ovis, Theileria annulata together with a particular Babesia in a dog. Now, so now, are there any host specificity with these new strains? Do we have mutations? I read about Babesia species and mutation. Scientifically, it's not been able to be proven as far as my knowledge, as far as today is, and the limited resources I have. Mutations have not been critically looked at. Some have looked at mutations, but some authors have said, no, there may not be really mutations, but so many researchers are beginning to question the fact that we may likely in the nearest future, or even now, begin to have mutations in these Babesia species and subspecies. Now, are there any particular or typical clinical signs that we should be worried about? In my work, this particular one that gave us a new strain had atypical signs. It came in so innocently. But look at what we have. Now, what is the virulence of this new strain? Can we have more cases? Like I was discussing with Dr. Charles Ibe and Dr. Amaka just before we started. Can we have more cases reported and have intergroup discussions? What did you see in your clinic? What did you see in your college? What did you see in your veterinary hospital? And come have a roundtable talk. That what are we dealing with? How can we harness resources to make sure that we end this menace, at least to the barest minimum? Should we begin to think or worry about drug resistance? Because by the time you're having new strains is calling for more trouble, because you may discover that these new strains may not easily respond to the drugs that either we have been using. Okay, I've said the fact that we have T. ovis and T. annulata in dogs in Abeokuta. Then Takit et al. Reported the fact that we have genetic diversity among these subspecies. And this actually could affect the clinical outcome of these dogs. Now, taking you further into my work, or part of my work, I decided to check for the mortality rate with respect to the blood types. Now, in dogs, they have the dog erythrocyte antigen blood type, just like the humans have O, A, and the rest. So dogs have DEA. And so I decided to look at DEA and Babesia status in the study population that I did in Southwest Nigeria. And this is what I found out. I found out that for the dogs that had DEA1 negative, they actually had a lower, look at that red cycle, lower mortality compared to those that have DEA1 positive. DEA1 negative, they had lower mortality compared to their counterpart. So are we saying, or can we infer that actually dogs that come in with DEA negative, can we use this as a prognostic factor to say if a dog comes in with this type of blood group, their blood type, there is a tendency or probability that it would survive more than a dog with DEA1 positive. That is a food for thought. Then there was a dog that came into the hospital, and we were suspecting Babesioses. I was worried about the presentation. So I was thinking, could this be a complicated canine Babesiosis because it had cellulitis, and we aspirated loads and loads of pus from the side, from the abdominal region. It didn't have fever. So I was really at a point starting to doubt the canine Babesiosis tentative diagnosis. And because I had this kit, I said, okay, do you know what? Let us do this. And by the time I did this, I found out that if you look at the kit very well, I found out that I'd look at the control lines and look at the test line. This particular dog actually had ehrlichiosis. No anaplasma. Okay. All right. Sorry about that. Okay. No anaplasma. Okay. MTN. No anaplasma. No Babesia. Just ehrlichia. And this went a long way to help us in treating the dogs. The dog immediately we came in with doxycycline and so on and so forth. And the dog is bouncing, has bounced back, doing really well today. When the dog came in, it was a really bad one. But with accurate diagnosis, we were able to, instead of shooting in the dark, to say, okay, don't worry, it's Babesia, and you start giving Oxytet for 5 days, and you say, go home, and But by the time we went for doxycycline, it really gave us, a very good result. All right. So looking at the treatment protocols, recurrent trends, can we have one thing I would say maybe a protocol we should look at is we could, based on clinical science, you could have a tentative diagnosis based on the clinical science. Then by the time we come to diagnosis, we should be able to come with a proper diagnosis when we have done our lab work. So the lab outcome of the hematology, of the parasitology, and of the liver, kidney function test, and even ECG, because some of these dogs that come in with canine Babesiosis, they have myocarditis. And so some dogs, especially outside the country, they do ECG for these dogs. Then we can arrive at a diagnosis based on not the parasitology now, but the fact that, we are able to do an abdominal scan to check for the status of the liver, status of the kidney, like I said earlier on. Then can we begin to think of doing blood types and blood transfusion? I love doing blood transfusion, especially when I see that the PCV of a dog is lower than 10. I begin to tell the clients, let's look for a donor. Let's quickly save the life of this dog. So we do blood transfusions at that recommended dosage. Then we do fluid therapy. Like the case I said I handled that came in positive on PCR. By the time we did fluid therapy, because it came in all diarrheic and having been dehydrated. So at that particular dosage, then antibiotics, tetracycline, accurate dosing, doxycycline, accurate dosing, diaminoxine acetate, accurate dosing. But the way I handle, or I was taught to handle diaminoxine acetate is that you can give once at 3.5 milligram per kg subcute. Some people give IM, or you give a divided dose. If you have calculated the total dose, give the first half today, give the next half tomorrow, just because of the side effects, of these drugs. Then you come in with hematinics, folic acid, and the rest. Then there are liver medications, Silibon or Silibion or Silimarine and other liver medications. This dog should actually be placed on good diet, nutrition, and extra nursing care. I had to stress the nursing care because most clinics, you don't tend to see the nursing care. Sometimes people just give these antibiotics, give these drugs, and the nursing care is missing. Infusing nursing care will go a long way to help the life of this patient. Now, looking at prevention and control. To prevent and control this menace called babesiosis, we need to actually diagnose rightly. We need to do early detection in sick dogs. We need to do prompt treatment, and we need to do correct dosing posology to make sure that the dose of the drug we're giving is accurate for that particular disease, so that we don't have it lingering in the populace and becoming, a continuous continuously being endemic. Then tick control is very important. We need to use antiparasiticides, advise the clients of the need to have tick repellent collars, tick shampoos, tablets, fumigation, and so on and so forth. This will go a long way to prevent and control this infection. Now, these are selected references, and I just want to thank everyone for being prompt and attentive to this lecture. Thank you.
Yeah, I think you should be more a marketer than a teacher. because of the fluidity of your tongue. We in the marketing, we drop some sweet honey in our tongue, so that when we tongue market you, you buy our product.
Okay.
I think we are buying your research. Maybe we will discuss much on what we can do to expand your frontiers.
All right, sir.
Yeah.
All right, sir. I truly appreciate it, sir.
We need to discuss how we will expand your frontiers. And one thing I gained is, before we were thinking that proliferation of faculties are antithetical to our growth, but I think proliferation of our faculties I think they're in sync with our growth. Because if we are only UNN, Ibadan, and ABU that we were when we were UNN, we were undergraduates, anyway, my degree was coming on board. Their first set was my set. I think we won't get this far. But because we are in Abeokuta, that's where we are getting this far. Something might be happening in Abeokuta. The ambulatory mechanism of UI might not reach Abeokuta. And all these things you are getting now is on board. And it will be on the subnatant stage. So yeah, so that's the thing. When you are talking about blood expanders, I feel because of the nature of the world today, the endemic nature of emerging and re-emerging disease, I think you people in research, you should be thinking about, instead of blood transfusion, you should be thinking about HEMA cells. HEMA cell. You know what I'm saying? That is non-living, but contains some of the things the blood has. I believe human cell will go a long way in helping us, so that we don't end up putting up iatrogenic factors into where instead of curing, we create more problems. But that's been because the blood screening, I don't know the level of blood screening in veterinary medicine right now.
Yes, exactly. We do that at FUNAAB here. But like I said, the kits are very expensive. So we do the blood typing, and we do the hematology of the donor. We have to ensure that the donor is not infected, is in good body. There are criteria in choosing a donor. We just don't stumble on, there are a certain criteria.
Yeah, you know,
But that's beyond the scope, so I didn't want to bring it.
you are in a faculty of veterinary medicine where you have some facilities. Somebody might be in the bush and
Yes,
don't
sir.
get these facilities. And that's why there should be a link.
Yeah.
You know, this existing in silos cannot help us.
Hmm.
The only way we can is that people from the field should be giving you information and people which you work on. And
True.
you will be giving the people in the field information you're able to get at, you know, so that two of you will cohere in this cognitive drive to handle some of these cases. Okay, look at the emergent forces.
Yes, sir.
Emergent forces right now. And when you, to my own understanding, when you're moving from virology to bacteriology and protozoology, the mutation doesn't mean, after all, malaria, some of us who have had chloroquine in our life, originally was two doses, 2 times. It got to 3 times. I think now it's up to 4 times because of resistance. And most of the resistances are born out of mutation. But it's mutation, the full-blown change on strain change. It might be in the same strain, but to move from one strain to the other mutation, it happens highly in virology. And as you are ascending the taxonomy, it's dropping. The difficulties are coming up in terms of species variation and stuff like that. And I believe most of these species that I imagine are there, but they've not gotten the fang to create clinical problems. That's what hello, Funke.
Yes, sir. Yes, sir. Actually, some work was some work have been done, and it saw that with subsequent passaging, when you have this species moving from one animal to the other, even maybe dogs to cat to humans, that at subsequent passaging, it tends to reduce in tenacity. But we cannot ascertain yet that there is no mutation, even though there's a reduction in terms of passaging.
But advanced tracking, PCR tracking can be able to you know, when you study at the PCR molecular level, advanced molecular study can
very important,
can help you to do some tracking, whether there is a mutation or no mutation. But you see, in that case, it's advanced. It's not a normal molecular thing. So what I'm saying is that some of your samples should go to some lab, apart from Nigerian labs, should go to some advanced lab.
Yes, some of them actually, they went as far as Japan.
Good. So that's molecular tracking can be able to tell you whether there is a mutation, whether there is variation, molecular variation, and whether it is what do you call it? You know, gene reassortment, and there's one name for them. I've forgotten. You know, I'm a trader. That you're talking about overt change and minor change. There's one name for them. You know. Okay, let me continue. I'll come back to that. So and then drug resistance. I think we should deal with it. You will deal with it. Maybe somebody can ask some questions, and then the okay. I think Amaka, okay, I was talking about antigenic shift and drift. Actually, that was what I suppose in the shift and the drift, the major shift and the minor drift. That makes up mutation and makes up variations. It happens high in virology than in bacteriology. Highest in virology, maybe higher in bacteriology, and then highest actually, and in virology, and least in protozoology. You know, it talks about mutation. Mutation happens by these influenza viruses. They happen. It's so easy in virology than in bacteriology. And then as you move up in taxonomy, that's why you cannot see human being change to animal tomorrow. because you know what I mean. So as you are
Yes, sir.
moving taxonomically from lower species to upper species, you are encountering list in mutation. Anyway, that's it. That's
Yes,
my
sir.
understanding after a lot of studies, actually.
Yes,
Because
sir.
when I study with
Yes, sir.
references.
Yes, sir.
So that is it.
Yes, sir.
Yeah, somebody is requesting meeting summary with famous is requesting meeting summary with AI, artificial intelligent companion. Well, you people in artificial intelligence. Okay, you want me to enable it? Okay, I will enable it because you're Femi. But anyway, so that's it. So let's see how far we'll go. Please, Amaka, sorry for taking part of your work. You know, at times, yes. And she did a lot. Come unmute yourself. And before we came on board, we are discussing where do we really place. From what you're saying is protozoa, because I've seen merozoites. It's protozoa,
Yes, sir.
but it has
Yeah,
some
we
bacterial
propose that.
characteristics. That's why you have some antibiotics you use in bacteria. You use it in treating babesiosis. And then another thing I want to point out, sorry, is the the barriers, the areas we have been able to locate in the bone marrow. And you know, it's typically blood don't just flow to bone marrow. There are some barriers it has to go through. And then as drugs are getting to those areas. So anyway, there's degree of relapse, actually. Maybe you clear the blood, some of them can come from blood and relapse into the blood again to start creating you all those clinical stigma. But come on, Maka, please, sorry. Let's move on.
A very, 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 very thunderous applause to you, Dr. Olufunke Adebayo. When you were giving this
Thank you.
presentation, I was like, it was a complete overhauling of what I kind of knew about the Babesia, you know, and I'm like, it got me thinking about a lot of things, especially when you said beautiful Babesia. And then coming from a parasitologist point of view, it's I will tell you that they are beautiful. Parasites are very beautiful organisms. And remember, they also want to perpetuate their generation. So who's to say that they are not? I mean, in their own world, they are truly beautiful. And there needs to be a rethink of symptoms associated with Babesia infection. And not only Babesia, but like most infections that we come across, even with our animal patients and in human beings. For example, when we are talking about the complicated and uncomplicated canine babesiosis, as they've been given the same classification as malaria, if I got you right, I could see that there were similar presentations to malaria. And I mean, what do we know? Is it possible that some cases of human malaria that we've been treated as malaria could be babesiosis, seeing that it is now an emerging infection? And then we have this constraint of proper diagnosis. I mean, I'm not trying to sound preposterous or, you know, scare people, but I think it's something that is actually possible and we should look into. And you also know that like malaria has gut presentation, gut symptoms, you know, and then Babesia also has, and it's leading us to the role of undiagnosed conditions when we talk about health control of these infectious diseases in the environment. I would want to know if you've come across a mixed infection in the course of your research. No.
Okay. Yeah, thank you so much. Yes, actually, so I want to clarify one thing. Looking at, you were talking about the human babesiosis, that what if even this human malaria that people have is human babesiosis? Well, the good thing for now in Nigeria and this part of Africa is that we don't have the Babesia microtype or the microtype-like organisms resident with us. So it gives us a sigh of relief to know that, okay, we can say that, okay, maybe the malaria have just been either uncomplicated malaria or complicated, malaria. We do not have evidence yet to show that we have Babesia microti in Nigeria or in this part of the world. And I'm really praying we don't get there, because human babesiosis is another ballgame entirely. It's so devastating to affected humans that sometimes they have to remove the spleen of such humans. It even affects now. If a splenectomized person or animal now comes down with babesiosis, there is nothing else, to fight with. So looking at whether we have some complications with regards to babesiosis, in my case, yes. In fact, there were so many cases that, especially those that came down with, I had so many groups. Some groups did not have babesia at all. And they came with clinical signs that you would just think this is babesia. On PCR, it was a no-no. You will be shocked to know that even on thin blood smear, we thought we saw things that were like babesia, that we could beat our chest that, oh, this looks like, babesia, maybe a babesia fragment. But PCR said, no, that was not babesia you saw. So interpersonal, lab idiosyncrasies, they go a long way to help us in diagnosis. And with the complications I saw, there are some that, apart from the fact that they had ehrlichiosis, some already had managemental problems. They were not well taken care of, so immunosuppression and so many other things. So there are definitely other complications. Some age factor caught up with them, with their age coming down with babesiosis. They already had other age geriatric, issues, and there's so many other complications that could come with babesiosis.
Yeah, Amaka, but one thing I want you to know is that when you look at the vector, I don't think we have human ticks a lot in this country because of our hygiene. For you to have such complication, the vectors should intermix.
But they do.
Yeah, they should.
Humans get bitten by ticks.
Yes, humans get bitten by ticks, but not as dogs. You understand what I'm saying? I was bitten by a tick. In fact, tick was removed from me when I was 6 years old. But you see, it is very rare. From that till now, I don't think I've had tick bite or whatever. So you see, when you look at the tick infestations between human being and animal, you see that it tends to be far, far, far low in human than in animal.
The risk of exposure
for you to get to epidemic endemic status of the two.
If I could comment, sir, based on my research, I actually found out that you'll be shocked to know that dogs that come with heavy infestation, sometimes they came away babesia negative. They had anemia because of the mode of infection of the RBC lysis. But the ticks that were biting probably were not infected. So they didn't come down with babesiosis. I think the fact here is that the ticks have to be infected before they can now transmit.
So
that's baseline. Is enough. Yeah, just one bite from one tick is enough. Yeah,
it's enough. And then when you are dealing with heavy tick infestation, that means you are discussing about hemorrhagic anemia and not hemolytic anemia. There are two different types of anemia. They can suck a lot of blood and the host becomes highly anemic. And that's why you are getting that anemia. You are not getting the anemia because of the lysis of RBC. No, you are getting the anemia because of the shortfall of RBCs, because they are sucking out a lot of blood containing RBCs. Anyway, continue.
I think the point I'm trying to make here is the exposure risk. So I would like disagree with you when you talk about that, when you say that our hygiene level when it comes to contact with animals like our pets is quite high. Because then we have those in the urban region and people in the rural areas. who have like their hunting dogs and they sleep with them and they don't know, I mean, they don't appreciate the risks that these vectors carry, especially the ticks. If you understand what I mean.
I know.
They don't appreciate that these ticks could carry diseases that are harmful to them. So I'm coming from the behavioral, people's culture, people's behavior. Out in the Europe, in the Americas, where people do a lot of hiking, they go into the habitats where these ticks and their wild animal hosts are. They come in contact with them, they get bitten, and they come back to their house, and then they start manifesting this. Just like Dr. Adebayo said, just one tick bite is enough. Now, in our rural places, at least around here that I live, people lie down with their dogs, people carry their dogs. I mean, the rural hunters, those that have it in their homes that are not really well educated regarding the risks that these tick vectors carry. So they lie down with it. They just say, oh, this is just, no, but this is just a tick. It's, it does nothing. So when people like that are bitten by just one infected tick, the risk is very high considering their level of exposure. You understand what I mean? Their level of understanding, their level of education concerning these vectors. So that is what I'm talking about. And now, if we don't know what we have in environment, which is very dangerous. We don't know what we have. So if they are bitten by ticks that are infected with these organisms, then our treating their condition is going to be very difficult for us because, like I said, we don't know what they have.
Then for those who are asking for presentation, it's on the YouTube. I've said it several times, and I've sent the link several times. And one thing, when we finish, I'm going to send the YouTube of this topic, of this video, around all the platforms. As I'm getting it in the platform, please be expanding it in other platforms. And you, the moderator, the speaker, the lecturer, I'll send the video specifically to you so that you can share it around, because most times what we found out is that when we bring presenters here, they draw in a lot of their own personal crowd that are not within our catchment areas. So you can share it around. Dr. Funke and Adebayo,
Yes,
and then my beloved wife, Dr. Amaka, she's still eating my money. Don't worry. From that day, you continue till eternity. That we're giving you blanket check. Okay, anyway, that is it. If we have any other comments, let's have it here. So as she's talked about how do we create awareness to these royal people, educating them the danger of harboring. The extensions people should be able to come on board, because I think we have Center for Disease Control now all over the world, including in Nigeria. With that, I think they should have an extension department, all this hectare so that the people will have awareness. We are dealing a system in Nigeria. It's easy to pass words across through the traditional rulers, through the town unions, through the market unions, and what have you. But the Center for Disease Control, maybe we send part of this slide for them so that they can look at it, FAO, and see what they can do to see how they can create their own channel on discussing this part of disease so that people will be aware. So that whenever they see tick, they look at their bodies, and whenever they see ticks of their children, they remove it as fast as possible. Or any tick around. Anyway.
Yes, sir. Also looking at the rural, area, we have some of us here that have worked on hunting dogs. There's one of my colleagues here in Abeokuta that specifically she goes out for hunting dogs, because we found out that there are so many things going on, in the lives of these hunting dogs. You find them with tick infestation and so on and so forth. So many ailments that people will not want to, even talk about. So going to the rural area is key, is so important, because that particular project really opened our eyes to see the fact that, and they are so loving. It's just like Dr. Charles said, once you go through the community head, go through the associations, getting to the rural community is not a problem at all. In fact, they want this kind of awareness because they want to take care of their, and you would be shocked, they take good care of their animals. When you see hunting dogs, you see them big, tall, I mean, well taken care of, even as opposed to some people in the urban areas. Yes, thank you, sir.
Have you done screening on those hunting dogs and see whether herd immunity is helped because of exposure is helping them?
Yes, yes, some work are actually still ongoing. Yes, some work are still ongoing on them, sir.
Yes.
They have some ongoing work. Yes, sir.
Yeah, because they need, because of their continuous exposure, they might be more resistant. And then they might be reservoir host to the dogs in the domestic cycle. And they link between the selvatic and domestic cycle. So, you know, moving in the bush and coming into the town. So they can be carriers of all these diseases, but still resist the disease as a reservoir host because of their continuous exposure. Anyway, that's my mindset. Okay, continue. Hello, sir, sister. Is she with us?
No, I'm still here. I'm still here.
Okay. So if there is please look at Amaka, look at the questions on the chat box and see. Yeah. Look at the question on the chat box and see if we can capture. And if there's any comments, please, we will round up. On this note, we have Dr. Mbafo from Cameroon. She has been with us and she continued to be with us. Chikera is raising up. Unmute Chikera. Where is Chikera? Chikera, unmute yourself and then make your comment.
Okay. Hello, good morning, sir.
Yeah.
And good morning, all of us here, especially the presenter. It's so nice to hear your voice again. You were my senior colleague back then in Zaria.
Yeah, thank you, Doc.
My boss in the veterinary anatomy world. Please, my regards to him.
Thank you. Thank you.
Yeah, concerning
the husband is there with us, always with us. So she's hearing what you are saying.
Okay, perfect. Yeah, good to have you.
I mean, we are sorry for giving them disturbance on Saturdays like this. Okay, continue.
This canine babesiosis, I have a few questions. When you do a thin blood smear, and then you realize the merozoites in the red blood cells, is it indicative of babesiosis based on the number you see per field, or in a case where you just see one and you're very certain it is babesia in the red blood cell, is it enough to define your diagnosis as canine babesiosis? That is one, man. Then secondly, how often is paralysis associated with canine babesiosis, where the dog is presented recumbent and your analysis shows that it actually is not having sensation on the limbs, both hind limbs and forelimbs, and then it comes with other signs of babesiosis? Is it a very common presentation where paralysis is associated? And in that case, because I looked at your clinical signs, maybe it's an oversight. I don't think I saw paralysis as one of the presentation signs that you could also observe in babesiosis. Then lastly, this rapid test kit you showed us today, this triple test kit that has a Lichia, Anaplasma, and Babesia, is it readily available in the market? How can one have access to it, please? Thank you, ma'am.
Okay, thank you so much, Doc. Nice to hear from you again. Now, looking at the thin blood smear that you talked about, that the presence of even one doesn't mean that you can categorize as canine babesiosis. What I would say is that, number one, we're being taught that you treat based on your clinical signs, then you treat based on your diagnosis. If the clinical signs you have is not corresponding to what you have on thin blood smear, if I'm handling that case, I will hold on. But I will ensure that everything that has to do with boosting the immunity of that dog is being done. If the dog is not coming feverish, is eating very well, there's no complaint, and I did a thin blood smear and I saw maybe just one or so, to me, I would want to work with what I saw based on my clinical signs. Once I'm sure that I did a thorough check. So rather than pumping with antibiotics, now developing a lot of reactions or adverse reactions or resistance, I would just say, place on some medications that will boost the immunity of the animal, and then the animal is good to go. But in cases whereby either I don't see on thin blood smear, or I see one or two of, it doesn't matter, and I say that the clinical signs are in tandem with canine babesiosis, then I call it canine babesiosis as my diagnosis, and I go ahead to do the treatment. So that's that for that. Then looking at paralysis, yes, in the complicated form of canine babesiosis that I did on one of my slides, I think that was page 17, I made mention of rhabdomyolysis, which muscle pain and tremors due to serum accumulation of serum myoglobin. It doesn't come with the classical paralysis, like you put it, because I know that some people have approached me and they say, oh, okay, there's tick paralysis, I tell them that you have more of tick paralysis in ruminants. In dogs, we have not come to a critical point to say we are having tick paralysis in dogs or in companion animals, to the best of my knowledge. So if I am seeing paralysis in the dog, I want to know, am I dealing with muscle pain or tremors? Or am I dealing with something CNS involved? There is a cerebral form of babesiosis. In cerebral form of babesiosis, it can present with any sign, neurologic sign. So if you are having this paralysis, it could be or not be part of the neurologic sign based on the cerebral form of the babesia. So it's possible that you're dealing with cerebral babesiosis and so many things like that. So that's what I want to say on that. Then looking at the rapid test kit, yes, thankfully it's available. I got mine from Lagos. So if you want to contact me later, or if Dr. Charles maybe has a contact or will give me the permission, I could.
Yeah, there's a lot of kids flying about. In fact, I think Savan, you meet some good elements in Savan. They will get
exactly. Yes. Dr. Tunji Nasir and Dr. Abiadi. Yes.
They'll get into a lot of test kits are flying around.
Exactly.
And things are becoming more acquainted in diagnosis now, and not this trial and error kind of treatment right now.
Indeed.
Because of the nature of their client. The clientele is beefing up. And so I think Grace Kia wants to say something, but before then, I think I will advise seriously in canine medicine that oxytetracycline can be nephrotoxic depending on the preparation. I'm talking about oxytetracycline and not other types of tetracycline. More especially the semi-synthetic oxytetracyclines are safer in terms of nephrotoxicity, but I've not really tried them. I haven't really tried them on babesiosis. But if they like in anaplasmosis, they're very good in anaplasmosis, the semi-synthetic tetracyclines. And then you are dealing with what she's saying today, you are dealing with a situation of kidney involvement. So when I was happy when she talked about IV infusion. That means they have diluted the oxytetracycline, the one she used for her case. She diluted it in an IV infusion to be here. That might be the contact with the kidney might not be as much as, and the oxytetracycline, I don't want to market Pfizer's tetracycline called terramycin. LA is the best because they have a protein structure that holds the oxytetracycline in the liver as a depot and releases it gradually. unlike others tetracycline LA that are loaded, 24% loaded. These ones are loaded 20%, but they are releasing the protein structure, which is the anchor tetracycline, is releasing it gradually into the blood system. In that case, all these nephrotoxicity might not be as good as those who are pumping tetracycline LA. One means you put it in the body and then you allow pharmacokinetics to take care of the way they are released, natural pharmacokinetics from the liver. That's not the best. Anyway, Grace Kia is raising her hands. I believe she's a woman. Grace is woman, maybe some. Are you a man or woman? Grace Kia, unmute yourself and then offload what you have in your mind. Okay, she's a woman. Sorry, I didn't see your face. Unmute. Unmute yourself, please. Grace Kia.
Well, good morning, Dr. Charles.
You're a woman,
Sorry.
don't worry. I won't ask you that question again. Even your voice. Continue.
Hello, hello, Dr. Charles. Good morning, and good morning, everyone. I'm just so excited to hear my friend, my sister's voice, and hear so much of the work that she has done. Very awesome and very commendable. So I just wanted to find out the test kits that you have used. Could you just advise on which particular one you think is you recommend for use? Because I know that for the ones that you have used, I don't know the specificity and the sensitivity of the test kits. I've worked with a lot of test kits for my viral studies. I'm not a parasitologist, but I'm a viral person. And I know that there are those ones that I will never advise anybody to use, especially for instance, in the case of rabies, where you don't want to take chances. So we have we have the one that we can advise people to use. Even with that, we are still cautious on the use of that. So I don't know if you, from your experience, what you will say to people that are practicing and would like to use these test kits. Thank you very much once again for a beautiful presentation.
Yeah.
Thank you.
Doctor, are you Professor Grace Kia or?
Yes.
Yeah, you are Professor. Where are you based, please? Anyway, Funke will catch
I'm
you.
Grace Kia. I'm from ABU Zaria.
Okay, close to me in
Thank you.
Zaria. Okay,
Yes,
don't
sir.
worry.
Yes,
Funke, she's your sister. You'll catch her for
Yeah.
us. We'll give her
We
a
were
topic.
actually reading partners. We're sisters and reading partners in school.
Okay. Don't worry.
I'm best of friends.
That makes it better for us. That means she's in our net already. She's in our net.
Yes.
We
Thank
know
you so
how
much.
to catch. We caught Funke through Omobowale, honestly.
Yes.
And I
Yes.
mean, and we need such recommendations. We are
Yeah.
not island to ourselves. And being that we are not island to ourselves, we should have a connecting rod on how to connect with people who can teach, mentor. The idea is mentor. Crazy. This you're laughing at jackass. It's not
my
a
elder,
corporate. It's a corporate laughing, not even corporate smiling. A DP is corporate smiling, but the emoji is corporate laughter. Anyway, whatever be the case, whoever has something to say.
Yes.
Please,
Addressing Professor Kia's question on the kits, with the introduction of these kits, whichever one we're able to lay our hands on, it's important that because of the fact that we have the subspecies canis in the species canis in Nigeria. So we have Babesia canis in Nigeria. So when you're going to get any kit, just make sure that it's Babesia canis that is there, because some sell with B. vogeli or any other one. So as long as you specify that any combo you're going to get, you should make sure that it's BC, Babesia canis. That will go a long way to help so that you don't they don't sell a wrong one, like Gibsonite, especially to us. We don't have Babesia Gibsonite in Nigeria. So but with the type, I may not be able to specify the types, but I guess with more use amongst us veterinarians, we'll be able to now choose at a particular time that, oh, okay, I can count on this particular product or that particular product. But for now, I think by and large, anyone we're able to lay our hands up on, they seem to be doing a very good job so far because they are pretty new in Nigeria.
You mentioned that we don't have this in Nigeria, but you know we have a porous border where all these hunting dogs can cross, go and come back. It might be on our neighboring client, and then our quarantine should be on a watchful sitting position to see that we don't get these things into the country.
Yes, sir.
Then for those who are looking for our slides, it's so easy. Our YouTube channel has them. We will send this video around, and as you launch into this video, you are entering into our YouTube, you are seeing the video, you will watch the video. And make sure, because the swiftness and the profligacy she was talking, you need a very good network to be able to catch her speed. Let me just say the truth. To catch her speed, you don't need a network that is driving to be able to learn from what she has just taught us today. Please make sure your network is so good. Badge into, and please, like I said, we have a lot of topics coming up. If you click the notification button, next time it will tell you what topic we are coming up with. And then if you click the subscribe button, it will further the algorithm of our viewing channels, and then many people can be able to read it, view it, watch us, and then our content will go far. So please, we plead with you, make sure you subscribe to our channel as you watch our videos on the YouTube. Monday Ojamiran was yes. Monday Ojamiran has just said thank you, Dr. Ibe. Don't mind him. He was there when they're killing me with shots on the goalpost when I was a goalkeeper NYC in Kaduna. In 1987 session, he was my mate in Kaduna. I think he served Niger first, yes, while I served NMPE. December, we really.
There's a question for.
Yeah. So who again? Any question again, please?
Yes, there's a question for Dr. Adebayo. So it's from Dr. Samson.
Okay.
Akintunde. So Dr. Samson is asking, so there's a school of thought that believes babesiosis may not be completely treatable, but rather goes into a phase of pre-immunity, a situation of the infectious disease present, but subclinical. So Dr. Samson wants to know, how true is this, especially in dogs now?
Thank you very much, Dr. Maka. Well, it's not as though it goes into a form of pre-immunity. What happened is that most times they are not properly diagnosed or misdiagnosed. So when there's a misdiagnosis, the infection will have a way of, the body will have a way of adapting itself to that infection, and it will seem as if it's lying there, not doing anything, cool, calm, collected, until there's immunosuppression, and then voila, it comes up. So it depends on how it was diagnosed. It depends on how appropriately the drugs were given, the dosage, very, very important. We should give the right dose at the right time, and then we should ensure that, indeed, convalescence occurs. Just like in malaria, we have people treating malaria, and before you know it, in the next few weeks, they are back with the same malaria. Yeah, convalescence occurs. It depends on the state of the body at that particular time, the state of immunity at that particular time. So there are so many factors that brings, I would rather call it convalescence occurring due to the state of the immunity and the state of, the procedures that were considered during the time of treatment. So I think that's my take on that.
Tayo has a very valid question. Please attempt that Tayo's question. And then he will, I know he has a lot to say on this topic. On this is answer. He has brought out himself. After you must have talked, you will have a follow-up from him. On multiple organ failure. How you can handle multiple organ failure. arising from babesiosis.
Okay, thank you so much, Dr. Charles, and thank you, Professor Moboale Mayoga. Well, how you handle cases with multiple organ dysfunction syndrome? Like I said, this multiple organ dysfunction has to do with certain mechanisms, pro-inflammatory and anti-inflammatory, which could lead to renal failure, liver dysfunction, muscle damage. So, handling this type of cases will be number one, because some of these cases you see that they are hypotensive and they have poor tissue perfusion. So number one, and some of them, most of them come in with hypovolemia and hypoxic. Number one, you want to connect this dog to a ventilator. Most of our hospitals do not have this, because when a dog is hypoxic, to prevent further hypoxic injury, you want to fix immediately to a ventilator. Make sure that the dog is breathing well. And then following, after doing the hematology, you know what the PCV is. There is a particular level that the pack cell volume gets to, and you don't want to do hemodilution through fluid transfusion. So in that case, we can give plasma expanders or just go straight for blood transfusion after doing the appropriate procedures, in screening and everything from a good and selected donor. Blood transfusion will go a long way to increase the hematocrit of this patient to a particular level. When the hematocrit is increased, the hypoxic injury reduces, and then hypovolemic shock will not, come in because of the increase in the hematocrit. And with this, we are able to prevent hypotension and further injury to the kidney. In the case whereby we have a dog coming in with multiple organ dysfunction in the form of having a liver dysfunction, what we want to do is that we want to place on liver medications. Liver medications will go a long way to help, the liver to, revive again to a certain level.
Yeah.
When we have done an abdominal scan and we see that, well, the integrity of the liver is still intact, or the echogenicity, we still have, good echogenetic structures, then we can still push in with our liver medications. If the dog is coming in with renal failure or the rest, like I said, you want to take care that it's no longer hypo or hypertensive. When we have lung pathology, the ventilators will help with that. When you have muscular damage, we may need to do a lot of things. In some advanced countries, when we have dogs that come in with rhabdomyolysis, they actually place them on swimmers. There are these swimming baths that helps dogs that have neuropathies, that affect their limbs. So you want to take them through certain procedures that will help them, get them back, to shape in good time.
That's
I think to the best of
that's physiotherapy.
Yes, physiotherapy, yes.
Yeah.
So I think to the best of my ability, this is what I think. Some school of thought have actually said you don't give anti-inflammatories because the body is doing its job, and then so you come in with anti-inflammatory may affect the mechanism. That is still a school of thought that is neither here nor there, depending on the clinical science that's being presented. And of course, going in with antibiotic first line of treatment will help reduce this further pathology that we see in these animals. Thank you so much, sir.
Thank you. Tayo, top it up before Abese will talk.
Yes, sir. Yes, sir.
Yes.
Thank you, Dr. Ibe. Dr. Adebayo, thank you very much for this beautiful presentation, which has updated our knowledge on this very important and highly endemic condition in our country. Yes, there is actually not much to add. I would just want to advise veterinarians that babesiosis sometimes can confuse the veterinarian. Like she said at the beginning, you can have the complicated form and the uncomplicated form. The complicated form can serve as a real clinical challenge for many veterinarians. The uncomplicated form, which is what many people are used to, there is anemia, there is fever, there is jaundice, these ones that are related to blood infection, which many people are used to. But the complicated ones in which you see organ dysfunction, you could have problems with the eye, you could have with the cardiovascular system, with the nervous system, with the GIT and all those things. As veterinarians, our knowledge of internal medicine has to be very, very good, very, very, very solid for us to be able to even manage these conditions. Because even when you know that the problem you are dealing with is babesiosis, and it is the organism causing various systemic dysfunction. Just treating with imidocarb or diamynazine or oxytetracycline or doxycycline or any recommended drug for killing the organism will not necessarily reverse the organ pathology, the organ dysfunction that you see. So we have to be able to recognize the organs, the systems involved, and we should be able to manage based on the clinical signs we see. For example, she talked about hypertension. Hypertension is a common finding in babesiosis, especially the complicated one, the complicated type. We must be able to give medications that will bring up the blood pressure. And how do you even know that an animal is hypotensive when you do not have a blood pressure monitor to monitor the blood pressure, things to monitor the cardiovascular system and such. So as veterinarians, as clinicians, we need to be very intentional about being able to discover these complications and being able to manage them. Once again, thank you very much, Dr. Adebayo, and also thank you, Dr. Ibe, for organizing this.
Thank you so much, sir, for that enlightenment.
It's an institution. This is your DP, Tayo. Is it your wife, your child, your daughter, your mother? I don't know. Tayo. Okay, it's locked up. I will say, unmute yourself and discuss.
Oh, thank you very much, sir. Dr. Olufunke Adebayo, a wonderful presentation.
Thank you, sir.
Very, very happy and glad part of this Bluebird TV, and I want to appreciate my boss and mentor, Otendo Chief Charles Ibe, for coming up with this every weekend. Thank you. While you were presenting, I was more educated in the line of babesioses, because after school, I think I went into strictly poultry production, where I had no business with much canine practice. But today, I was refreshed with a lot of educative and inciting issues about babesioses. Thank you. I'm glad I'm here today. I want to make a kind of, let me say, is it a request or a proposal? Because when my boss said he will present maybe this slide to NCDC, I think, I don't know, but if I'm correct, NCDC only deals with zoonotic disease. And is it not right for us as a profession to start looking into a kind of body like NCDC, let's say the National Center for Animal Disease Control Agency for Food Security and Control of Transboundary Animal Diseases, through this new ministry that come up? I think if we start pushing as a profession towards this direction, it will go a long way to open up the space for we veterinarians, and and diseases like this can be bring up and trashed very well, so that in the future we'll be safeguarded and have food security in line with the presidency. I don't know if something of that nature, we can do it.
Yeah.
Just like,
Well, we
yeah.
have a semblance of it with the chief veterinary officer, who is the chief animal disease control officer as at now. That's what the apparatus, the structure is right now. Well, she mentioned about the zoonotic segment of the disease. That's why we are saying that to come, we should send it up to the ladder to the Nigerian Center for Disease Control. Yeah, like you said, that for zoonotic diseases, and there's a zoonotic angle from what you discussed today. So that's what brought that topic of the name NCDC. Yeah. Whoever has some words, so that we'll start firing away from here. Sure.
I would
Thank you so much, sir.
Sorry.
I would like to add, because people are still wondering if a follow-up from what Dr. Abase is saying, we should remember that this is now an era, and key into it, an era of One Health. So this both the health practitioners, the veterinarians, and the environmentalists, everybody is now involved in the control of infectious diseases that have that potential to get to an epidemic or pandemic scale, just like Dr. Adebayo said. So human babesiosis is an emerging zoonotic disease. Human ehrlichiosis is, human anaplasmosis is. Now, it is possible that because of underdiagnosis and because we don't have the proper pathways, or maybe we don't have the proper pathways to diagnose, or it didn't occur to us, whatever the reason may be globally, that we didn't realize that these diseases are zoonotic actually. But that's why we're not saying that they are now emerging. They are now emerging. It is possible that they have been, but for now we regard them as emerging zoonotic diseases. So these, especially these tick-borne diseases, most of them are now emerging as zoonotic diseases.
And many will emerge too. We're in the era based off a lot of climatic factors, global warming, movement of people, movement of animal. A lot of diseases are bound to emerge, to re-emerge. So this one that is our era. And being a vet, we should key into the order, because the world order now is, where do you key into the world order? That's it. How do you key into the world order? As you are growing in the practice and in knowledge of the profession, try as much as possible to key yourself into the world order. There should be an explosive need of veterinarians at this point in our life, in all spheres. So where do you key yourself? Is to view topics like this, discussions like this, you come and hear, and then go back to your closet and see how you repackage yourself so that you'll be able to key into the world order. Because the more you key into the world order, okay, look at the veracity of knowledge we have today, because we have 1.5 or 2 hours to sit down to listen to Funke Adebayo. So that's it. She mentioned a lot. You see, we have our limiting factors, but we should learn and be able to see whether we can adjust against those limiting factors. The important thing is that this is an animal, and we don't, please, and that's why I like veterinarians now who are using kits now. When we started practice, we used drugs that cut across groups to be able to achieve therapy. All what the owner knows is for the dog or the animal to get well. But we have gone beyond that. You get an animal, you suspect it has a leakia, you suspect you have a trypanosomiasis, you suspect you have not typed it to what it has. Oh, this is fever. And then because you haven't even checked the blood to know what kind of organism that's causing the fever. You have started giving antibiotics, anti-protozoa, anti-this, anti-that. You are knocking off some organs. You can see multiple organ dysfunction. But if you're able to nail the diagnosis, you go straight and deal with it. If you have complications, you deal with it. That means if you have the diseases complicating infection, so maybe what do you call it in veterinary medicine? You will be able to deal with it as it is, not as it ought to be. That's where we make mistakes. We were able to achieve a lot in the analog era when we started veterinary medicine. But in this digital phase, a lot of things are coming up to help. So you don't even waste your drugs, waste your time, waste your medication. So that anytime you put in this time taking you to diagnosis. Diagnosis is key to any type of medicine. Any food can treat. Chemists treat malaria because people come with fever, they give anti-malaria in chemists. But that's not what we are. We are physicians. Because we are physicians, we are thorough. Thorough in teaching the students, thorough in practice. You save yourself a lot of money. If you use anti-this, anti-that because you are suspecting one, you are wasting drugs. And then you are creating a lot of problems, resistance. Anyway, whatever it is, because of misuse of chemotherapy. Anyway, I think we should be rounding up by now. Do we have Omobowale has spoken? Well, he's here. I have a lot of new people. Please introduce. This is Saturday. It's a Saturday medicine. Next Saturday will be with Olani Beku. I think I saw him. Has he gone on biosecurity protocol in poultry? This is somebody that has handled poultry at various value chain, from parent stock to commercial, at various value chain. He's coming to the second time we're bringing him. And we have another topic he's going to discuss for us. He's going to discuss next Saturday. Hopefully, he's going to talk, Dr. Olani Beku of Yamfi Farms. He's going to discuss on biosecurity protocol in poultry. It's another good topic. For those of us in poultry, I strayed into companion animal because I started with companion animal and poultry. Later, I moved to poultry, and now I'm a trader. So that's it. So if anybody has any other thing to add to what we're saying, so that we can round up, please do. If there's no, we will round up. I think we have some charts here. Yes, there's two more. Amaka, you gone? Have you gone?
I'm here. Dr. Adebayo she's been so kind as to reply.
What? Okay.
On the chats. Yeah.
So please find time to visit our YouTube channel. I will send the video. It was streaming. I will send the video. So who again? Do we have any other thing? So I think there's some certain thing I noted here. Yes, placental. Adebayo, please, can you expatiate on transplacental transfer of this disease, transmission of this disease? That's the vertical transfer.
Okay.
Yeah.
Yes.
Yes.
Just like any other form of infection could be transmitted vertically, once a dam or a beach has the infection, then there is an involvement, while in utero. There are in utero transmission of these infections from the dam to the puppies or to the offsprings. So just like the way any other infection goes on vertically. So that's why it's always good, and it's always been advised that you don't, once you have crossed the animal or the beach, you don't expose the animal to tick infestation. You must make sure that every other thing is done. If it's going to be on medication, everything is done, before you mate the dog, so that you don't have incidences of this happening during pregnancy. There are some times that we have seen some dogs come down with canine babesiosis even while pregnant. So what we do is that, following a scan, and we see that, oh, okay, pregnancy is positive, we tell the client two issues. Do you want the mother? Do you want both? Do you want the puppy? And why we ask this question is that some drugs that we're going to use to treat canine babesiosis, they will cause an abortion, or they will cause they will cause an abortion. So if we find out that at the particular stage where the dog is, even without treating alone is enough to lead to an abortion. So why not quickly save the life of the mother, and then she can have more puppies? Because if you leave the mother untreated, she won't be able to carry the pregnancy to term. The same infection will bring down the pregnancy. So we normally advise that, look, do all forms of treatment before. If you see that it's positive with babesiosis. If it's now positive with babesiosis in pregnancy, we want to look at what's the threat. Is choosing between the devil and the deep blue sea. If there's a life-threatening situation to the mother and also to the puppies, we'll rather save the mother so that she doesn't die. She can always have more puppies, because I mean that's what we can do at that particular time. But if we see that her life is not so threatened, we go ahead to tell the client that, okay, we're going to use something mild, oxytetracycline. We're going to use the barest minimum dose that we can use, and then watch out for side effects. This could lead to, because you can never say any injection you give, you could never say it could still cause an abortion. So we advise the client that, look, we are just taking a risk or a chance. This dog may have an abortion. If it doesn't have an abortion, you can have the puppies come with black tooth. Those are some of the side effects of giving oxytetracycline to a pregnant bitch, where the puppies come with discolored tooth. So once we have advised the client there, then he takes his decision, and then we do accordingly.
Yes, Dr. Adebayo, please. There is this semi-synthetic tetracycline like doxycycline. Maybe you will start looking at it. It's very good in anaplasma. Very good in anaplasma.
We use doxycycline actually, but we noticed that
it will not have the same side effect with oxytetracycline.
Yes, sometimes for the doxycycline, we've seen that, especially if it's in a complicated case and that particular dog has a renal involvement, we do not want to come in with doxycycline, because it will complicate the renal involvement. So in dogs that have renal issues, uremia, I mean, you can have this sweet kind of odor from the mouth, and you suspect that this dog is uremic. That is to show you that this may be a complicated canine babesiosis. I would not want to go in with doxycycline, because it will further complicate the renal involvement that is already ongoing.
Okay. Well,
yes, sir.
I think you've done justice to what you plan to give us today. You've done more. You've done much. Oh, thank you. At least for the first time, we are bringing these two ladies together, one as a moderator and one as a speaker. I think it's been an excellent day for us. Be it as it may, I am trying to recognize some of our heads. Many of them are no more in this program. Omobowale, I think, has gone. She's no more with me. We'll have Elisha from Emmanuel Elisha, I think, yes. We have him from MSD.
I'm still very much around, sir.
Okay, yeah, Tayo is still around. Tayo, thank you very much for being with us. And you're always with us. Sir. Remember our leptospirosis, which you are going to give us when we call you upon. Please don't tell us you don't have time. And part of the rules and regulations we have here is that we don't want people who tell us they don't have time. Me, personally, I don't have time. But I still have time to do this. So nobody should tell me that he doesn't have time. And then, Adebayo, we'll look for another topic to give you, please. Because I don't think you're only a babesiosis specialist.
No problem, sir. Internal medicine.
Yes,
cool.
Yes, in internal medicine.
And blood transfusion, abdominal scan, no problem. Thank you so much for having
somebody mentioned blood transfusion. Something got into my mind that we'll have a day for blood transfusion in companion animal, in dogs, especially. Yeah. We're going to have a day for blood transfusion. So at least for for the excellency of those in Savannah to be able to learn. So we have quarantined all our compartments, and then we're dealing with them one after the other. So thank you very, very much. At this level, I think I will knock off the YouTube channel, and then